Fine needle aspiration cytology, FNA, is being used with increasing frequency because of its major advantages compared with surgical biopsy. FNA relies on the sharp edge of the needle bevel to cut the tissue into small fragments which can be sucked up into the shaft of the needle. The more vigorously and more frequently the needle is moved back and forth, the more tissue will be shredded into fragments. As medical care moves towards outpatient and managed care, FNA is being increasingly utilized in clinical diagnosis to avoid costly exploratory operations. Any physician can include FNA into the routine examination of every superficial mass on any patient seen in their offices each day. Commonly used pistol grip devices are difficult to use as they are held with a clenched fist, are far from the patient, and are worked by the large powerful muscles of the back. The Tao Aspirator is an ergonomic syringe holder designed to be held with a prehensile grip, just as a pencil is, and operated by the high-precision muscles which move the fingers. The syringe plunger is moved to the 2 milliliter mark and snapped into the aspirator. The patient is examined and the size, shape, consistency, and depth of the mass noted. The amount of suction is preset and controlled by the regulating knob adjacent to the syringe. Amounts are 4 cc for lymph node, thyroid, and salivary glands, 6 cc for breast and firm subcutaneous nodules, and 8 cc for cysts and fibrotic tissue. The Tao aspirator is held with the thumb, index, and middle fingers. The needle is inserted until it is felt to enter the mass. The release button is pressed to apply negative pressure. The aspirator is vigorously moved up and down within the mass 15 to 30 times until a small amount of aspirate appears within the hub of the needle. Dense connective tissue will be felt to grind against the needle during this procedure. The needle is withdrawn and the syringe removed from the aspirator. The plunger is pushed down to express the air from the syringe and blow the aspirated material onto a slide. This is smeared in the normal manner, and this material can be used for a Wright's type stain that is particularly good for extracellular elements. The material clinging to the wall of the needle shaft is washed into a cytological fixative solution that will be processed by the laboratory. Features unique to the Tao aspirator include a pencil grip manner of holding to provide more control in obtaining cell samples, a release button to automatically draw back the plunger using a single hand, and a regulatory knob for adjusting a predetermined amount of negative pressure during aspiration. The combination of fluid collection media and the Tao aspirator will allow any physician to consistently obtain good FNA specimens.